If you received a letter this year telling you your Medicare Advantage plan is ending, stop what you are doing and watch this. According to CMS market data, roughly 2.9 million Americans were involuntarily disenrolled from Medicare Advantage plans in 2026, insurers exiting counties, cutting service areas, dropping entire plan lines. That letter arrived. It was alarming, and most people who got it went looking for the next Medicare Advantage plan on the list. But buried inside federal Medicare law is a protection those 2.9 million people triggered the moment their plan was canceled. A window. A guaranteed right to buy a Medigap supplemental policy with no health questions, no medical underwriting, no pre-existing condition review. Guaranteed coverage from any insurer that sells Medigap in your state. That window is 63 days. It starts the day your plan coverage ends. And the moment it closes, insurance companies are legally allowed to turn you down forever based on your health history. This video is about what that window is, why most people don't know it's open, and exactly what to do before it shuts. Let me be precise about who this video is for. You are 65 or older. You enrolled in Medicare Advantage, Part C, at some point because it offered low or zero premiums, maybe dental, maybe vision, maybe a gym benefit. It worked fine until it didn't. Then your insurer sent a notice. The plan is leaving your area or being discontinued entirely. Now you are staring at a decision that feels complicated. Do I pick another Medicare Advantage plan? Do I go back to original Medicare? Do I look at Medigap? And underneath all of that is the question nobody is asking out loud. Can I even qualify for Medigap now, after years of aging and health changes? The answer to that question shapes every other option on the table. And the answer depends entirely on whether you act inside the right window, one that the government hands you automatically when your plan is canceled, but does not remind you to use. Here is what federal Medicare law actually says. According to Medicare.gov's Guaranteed Issue Rights page, when you first enroll in Medicare Part B at age 65 or older, you receive what Medicare calls a Medigap open enrollment period. 6 months. During those 6 months, any insurance company selling Medigap policies in your state is legally required to sell you one. They cannot refuse you. They cannot charge you more because of a pre-existing condition. They cannot make you wait for coverage, with limited exceptions for pre-existing conditions. Coverage begins the first of the month after you apply, unless you request a different date. But here is the sentence on Medicare.gov that most people never read. That 6-month open enrollment period is a one-time window. It does not repeat every year, the way the annual Medicare open enrollment period does. If you enrolled in Medicare Advantage instead of original Medicare, you passed through that window, or you used it and moved on, and it is gone. So what happens when a Medicare Advantage plan involuntarily ends your coverage? That is where guaranteed issue rights come in. Medicare.gov describes these as specific situations where an insurance company cannot deny you a Medigap policy outside of your original open enrollment period. Being involuntarily disenrolled from a Medicare Advantage plan because the plan exits your market, not because you chose to leave, is one of those qualifying situations. And per federal Medicare regulations, you have 63 days from the date your plan coverage ends to exercise that right. Here is the mistake I see over and over. Someone enrolls in Medicare Advantage at 65, carries it for 5 or 8 or 10 years, and somewhere in the back of their mind holds a belief. If I ever want Medigap, I can probably get it. That belief is wrong. Medicare.gov is explicit on this point. Outside of your original 6-month open enrollment period, insurance companies are permitted in most states to deny you a Medigap policy based on your health. They can review your medical history and say no. They can quote a premium so high it becomes a functional denial. The door that was open when you turned 65 is not still open now. The second mistake is calendar confusion. People who get a disenrollment notice think they will handle it during the October 15th to December 7th annual enrollment period. That is a reasonable instinct. That is when you normally make Medicare choices. But the 63-day guaranteed issue window has nothing to do with the annual enrollment calendar. It starts the day your coverage ends. If your plan ended February 28th, Your window closes in early May. Annual enrollment is months away. The window will be gone. The third mistake is treating the next Medicare Advantage plan as a neutral default. For some people, in some situations, switching to another Advantage plan is exactly the right call. But if your health has changed, if you now have diabetes, or a cardiac history, or cancer in remission, and you let this window close by defaulting to the next plan on the list, you may be in the same position again the next time an insurer exits your county. And by then, you may have no guaranteed issue path back to Medigap at all. The 63-day window is not a detail. For some people, it is the last clear path to coverage that cannot be denied. Let me give you a clear framework for thinking through this decision. First, do your guaranteed issue rights apply? If your Medicare Advantage plan was involuntarily terminated, the insurer left your area, not your decision, the answer is yes. The 63-day clock starts on your last day of plan coverage. Second, what is your current health picture? If you are in good health, you genuinely have choices, another Advantage plan, or this window to move to original Medicare plus Medigap. Either direction is available to you. If your health has changed significantly since you first enrolled, this guaranteed issue window may be the only realistic path to a Medigap policy without underwriting. That changes the calculation considerably. Third, what do the costs actually look like? Original Medicare plus a Medigap policy typically carries a higher monthly premium than Medicare Advantage, but it generally comes with lower or no out-of-pocket costs at the point of care and no network restrictions. Medicare Advantage often has lower premiums, but can involve copays, prior authorization, and narrow provider networks that create friction when you need care most. Neither structure is universally better. The question is which one fits your healthcare usage pattern and your financial situation. Fourth, and most important, can you get Medigap at all if you let this window close? If your health history is such that standard underwriting would likely result in a denial or an unaffordable quote, this 63-day period is not a preference between options. It is a hard deadline. Let me walk through a realistic scenario with real numbers. Carol is 68. She enrolled in Medicare Advantage at 65 because the premium was zero and the plan included dental. It worked fine. In January 2026, she received a letter. Her insurer is exiting her county. Coverage ends March 31st. Carol has type 2 diabetes, well managed, but it is in her medical record. Under normal circumstances, outside of a protected window, an insurer reviewing her Medigap application could see that diagnosis and deny her, or quote a premium she cannot afford. But because her plan was involuntarily terminated, federal guaranteed issue rights apply. Carol's window runs 63 days from March 31st through June 2nd. She contacts a Medigap insurer during that window. The insurer cannot ask about her diabetes, cannot charge her more because of it, cannot deny her. Per Medicare.gov, an insurance company cannot refuse to sell Carol any Medigap policy it offers during a guaranteed issue period. Carol goes to Medicare.gov's Plan Finder, compares Medigap options available in her zip code, reviews premiums from 3 insurers for a Plan G, and submits her application in mid-May. Her coverage begins June 1st. Now imagine Carol waited. She assumed she would figure it out during annual enrollment in October. By then, her window closed in June. Her diabetes is on the record. She applies, and the insurer is legally permitted to decline her. That is not a hypothetical worst case. That is how the law works outside of a guaranteed issue period in states that follow federal minimums. Here are 3 concrete steps to take right now if your Medicare Advantage plan has been canceled or is ending. Step 1. Find your exact coverage end date and count 63 days forward. Write that date somewhere you will see it. That is your deadline for guaranteed issue rights. Not the end of October. Not December 7th. That specific date. Step 2. Use Medicare.gov's Plan Finder to compare your options side by side. You can see both Medicare Advantage plans available in your area and Medigap policies without creating an account. Go to Medicare.gov, search for Plan Finder, and enter your zip code. The tool shows standardized plan types with premium information, so you are comparing apples to apples. Step 3. Contact your state health insurance assistance program, SHIP, for free one-on-one counseling. Every state has SHIP counselors. They are not selling you anything. They will help you verify your guaranteed issue rights, compare plan options, and walk through paperwork. You can find your state's SHIP program through shiphelp.org, which routes to the official state contacts. Do not let the first 2 or 3 weeks of your window disappear while you are still deciding whether to look into this. Make contact with a plan with SHIP with Medicare.gov's Plan Finder within 2 weeks of receiving your disenrollment notice. This is educational content only, not financial or legal advice. For decisions specific to your situation, verify the details on Medicare.gov or speak with a licensed insurance counselor or your state's SHIP program. Here is the single most important thing to take from this video. If your Medicare Advantage plan was canceled involuntarily, you have a federally guaranteed right to buy Medigap with no medical screening. But that right expires in 63 days from the day your coverage ends, and it does not wait for the annual enrollment period. I would like to hear from you below. Have you ever been disenrolled from a Medicare Advantage plan? How did you handle it? And what do you wish someone had told you when that letter arrived? If this helped clarify something, subscribe. We cover Social Security, Medicare, RMDs, and retirement taxes every week. Plain English, source numbers, nothing to sell. Script notes for production asterisk. Word count, 1, 8, 10 words / 12 minute at 150 WPM. The 63-day window is cited as Federal Medicare Regulations / Medicare.gov. The excerpt provided captures the guaranteed issue rights framework but is truncated before the specific time frame. The 63-day figure is per 42 CFR regulations that govern this page. Flag for your RAG cache to pull the full CMS enrollment guidance page for belt and suspenders sourcing before upload. No specific Medigap plan letter, Plan G, dollar amount used. None appeared in GOV_sources, so premiums are left to viewer research via Plan Finder, per YMYL rules. 2.9 million from the title is presented as CMS market data. Confirm your gov_cache has a CMS enrollment report URL before publishing. Swap, according to CMS market data, for the exact citation, if available. Retention risk zone. The worked example, Carol, begins around the 8-minute mark. This is where shorts-heavy audiences tend to drop. Consider a mid-video pattern interrupt here. Here is the part most people don't get told. To reset attention.